there, welcome to the latest episode of A Sexy Thyroid Solution. I'm your host, Angela Brown. So today I want to talk about thyroid testing. But first, if you could do me a really huge favor, if you're watching this on YouTube, if you could go ahead and subscribe to my channel, and then you're going to hit that little bell so you get a notification every Thursday when I release a new video. And then if you're watching this on Facebook or Instagram, go ahead and like this, and maybe even share it with someone who would benefit from this. So let's go ahead and dive into this discussion. So I did a video recently that talked a little bit about thyroid medication and how different testing and things like that could alter your medication with what you're on, with what you're taking, what the doctor orders for you. So I wanted to expand a little bit further on this and talk a little bit more about the different testing for your thyroid. So something that I see very, very commonly in the women that come to me is they're not getting a full thyroid panel. It's very common for when a woman goes to a doctor and they say, I'm exhausted, I'm so tired I can't function, I'm gaining weight for no reason, I'm trying all these things and nothing's working, I'm hormonal all the time, I have anxiety through the roof, and the list goes on and on and on. And the doctor says, let's go ahead and do a thyroid panel on you. We're going to check your thyroid. So they do a blood test on you. And unfortunately, most people don't know that there actually is a full thyroid panel. So they get their test results back. The doctor either calls them or it's on their portal and it says everything looks normal. So first of all, what is normal? So that's a huge discussion in itself, which I'm going to dive into a little bit here. Reference ranges for what you see on a blood test are very, very different than the reference ranges that I see that people actually feel really good at. So what I mean by that is you're going to get your lab report and it'll typically say, high or low, and then it'll have this reference range. And the reference range basically means this range of where is they consider normal. Those reference ranges for most people, they don't feel very good in those reference ranges. They aren't functional, and that's what I call them. They aren't functional reference ranges. They aren't the ones that make you actually feel good and like you could function. So they tell you your TSH looks totally normal. Your blood test looks totally normal. And then I look at the blood test and I'm like, that's actually not normal. That's not going to make you feel good. That's what the lab says is normal, but that's not a functional range that actually makes you feel good. So that is something that I go into very much in depth with my clients is, first of all, I make sure they have a blood panel and I make sure they have a full blood panel. And then I go into detail with them. This is what you actually needed checked. And this is actually the reference range that makes you feel better. So if you're not feeling good and the doctor's saying it's normal, you have to demand A, further testing, B, that you don't feel good and that you actually need more testing, or you need to go find another doctor. And that's essentially what I had to do over and over. It was a total pain, but it worked. I finally got answers because I had to keep digging and I had to keep being an advocate for my own health. So the other factor is, what are they checking? This is the part that makes me a little crazy because most of the time they're just checking TSH. TSH is the hallmark test to go, your thyroid's slow or it's not. It's really one of the big tests that they're going to check. TSH is thyroid stimulating hormone. TSH actually does not assess what your thyroid itself is doing. It's telling me what your brain is doing. It is a hormone that is released from your brain. Thyroid stimulated hormone. It sends a signal to your thyroid to release more hormone. So if you're getting a blood panel done and all they're doing is checking TSH, how the heck do you know what your thyroid's doing? That tells me absolutely nothing. And in all honesty, I've lately been seeing a lot of women that their TSH number, I don't even go by it hardly anymore. I go by what their T3 and their T4 are doing, because that actually gives me a better picture. The TSH number can be skewed for a lot of reasons, but if I don't have the other markers, I can't give you a good picture of what your thyroid's doing. So I don't know how a doctor's supposed to tell you what your thyroid's doing if all they're checking is TSH. So what you need checked is TSH and free T3 and free T4. These are the two most important thyroid hormones. T4 is inactive, T3 is active. The problem is that you only make about 20% of that active thyroid hormone, which is your T3, and you make about 80% of the T4. You have to convert a pretty large amount of that inactive T4 over to T3. Unfortunately, almost everyone that has a thyroid issue, that's the issue. They can't convert over. So, for example, you go get a blood test, your TSH looks totally normal, and they don't check anything else. Well, what if you're not converting your T4 over to T3? You're not going to know from a TSH test. You're going to know if you get your T4 checked and it looks low or normal and your T3 is bottomed out. It means you're not converting over. You do not have enough T3. So the situation with that then is, what do? They put you on medication based off of a TSH number, not knowing what your T3 is. And what medication do they put you on? Usually T4. T4 does not make people feel good. And this is something that I have to be really adamant with my clients and have them adamant when they go see their doctor, like, that medication is not working for me because it is T4 only. I actually need T3, or I actually need a full blood panel. I need a full test to see what's going on here. The other thing that needs to be checked is your reverse T3. They don't check that hardly at all either. Most of the time they don't look at that. It's not a common test to be checked. What can happen is you're supposed to convert, like I said earlier, you're supposed to convert that T4 over to T3, your active thyroid hormone. If you can't convert over, a lot of times what happens is you reverse it. And that's why they call it reverse T3. So what I usually will end up seeing, if I can get someone to get a full thyroid panel, TSH might be a little elevated, T4 might look normal, or it might be on the lowish end. T3 is bottomed out, and the reverse T3 is through the roof. And it's because the T4 is fine. They have no T3, which is their active thyroid hormone, because it's all going backwards. That is a very bad storm for making you feel good. You are not going to feel good based off a test like that. And it's so common to see a test like this if you can get the doctor to order it. So you have to demand that you need a full test. The other thing, thyroid antibodies. That's another one. Anytime there is a slow thyroid going on, a lot of times that's present. It's very common, and we call it Hashimoto's thyroiditis. It's an autoimmune side of a slow thyroid, and it's actually one of the most common thyroid diseases. But again, doctors don't check thyroid antibodies. So a full panel is, you're going to get TSH, reverse T3, free T4, and your thyroid antibodies. And I actually have a whole guide on this, a huge guide that goes over all those markers, why you're getting them checked, and what my reference range means, what is functional. So if you need that, I have the link below that you can actually grab that if you want to go ahead and get that. And I actually have had clients, they printed it off and they took it to their doctor and they're like, I need these checked. This is what I want checked. So if you have any questions with that, reach out, let me know. I'm more than happy to help you. If you need any more tips and tricks on that, on how to get the doctor on board with it. The other thing is, sometimes you just got to go get it done yourself. There's so many labs now. I use one called Let's Get Checked. You can actually do a finger prick test at home and send it off. It's so easy. So if you have to get it checked yourself, get it checked yourself. It's not expensive at all, and it's totally worth it. So let me know if you have any questions, and we will chat soon on the next video. Have a great day. Bye.